Welcome to Older Podcast. Today we are talking about something that I think is going to genuinely change the way you look at your kitchen. Imagine a 67-year-old man. He is taking 4 blood pressure medications every single day. He is doing everything his doctor told him to do. He is disciplined. He is compliant. He never misses a dose. And he still ends up on an operating table with his chest open. And the surgeons look inside and find arteries so hardened, so rigid, that they describe them as concrete pipes. That image stayed with me when I first heard it. Joining me today to explain why that happens and what people can actually do about it is Nobel Prize-winning scientist Dr. Becker. Dr. Becker, welcome to Older Podcast.
Thank you so much, Dr. James. It is truly a pleasure to be here. And I have to say, that story you just described is not an unusual one. That is exactly what makes it so urgent to talk about.
So let us start right there. This man was doing everything right. 4 medications, perfect compliance. Why did none of that protect him?
Because medication, as powerful as it is, addresses the symptom. His blood pressure number was high, so doctors gave him drugs to bring the number down. But nobody stopped to ask the deeper question, why are his vessels becoming so rigid and so damaged in the first place? The medication was managing the reading on the monitor. It was not touching the root cause happening inside the vessel walls. And the root cause for most people over 60 is something that has been building silently for decades. After the age of 60, something structural begins to change inside the body. I always use the analogy of a garden hose when I explain this to patients because it is the most honest picture I know. When you are young, your blood vessels are like a brand new garden hose, soft, flexible, elastic. They can stretch and absorb pressure changes the way a healthy hose does. But as we age, those same vessels begin to stiffen. They lose their elasticity. They become more like an old rubber hose left outside in the sun for 10 years, brittle, hard, unable to give.
And when the vessels are that rigid, what happens to blood pressure?
The heart has to work progressively harder to push blood through vessels that can no longer absorb the pressure. Every single heartbeat becomes a harder push through a tighter, stiffer pipe. And the real driver of that stiffening is not simply age. It is chronic, silent inflammation inside the walls of the blood vessels themselves. I want to emphasize the word silent because this inflammation produces no pain and no obvious warning signs for years. It builds slowly and quietly over decades while a person feels completely normal.
That is genuinely frightening. No symptoms, no warning, just damage accumulating quietly.
Exactly. And here is the part that changes everything once you understand it. Every single meal you eat either fights that inflammation or feeds it. Food is not just fuel. Every time you sit down to eat, you are making a daily cardiovascular decision, whether you realize it or not. And that is the foundation behind all 5 strategies I want to share today.
I love that framing. Every meal is either fighting it or feeding it. Let us get into those 5 strategies. What is the very first one?
The first strategy is so simple that when I tell patients about it, there is almost always a pause. They wait for something more complicated. And I tell them, no, this is genuinely it. Eat your vegetables first, before anything else on your plate, at every single meal. Before the bread, before the potatoes, before the rice, before whatever carbohydrate is sitting on that plate, vegetables go first.
Just changing the order of what you eat, that actually produces a measurable difference?
A significant and measurable difference. Here is exactly why. The fiber inside vegetables does something physical when it reaches your stomach. It forms a kind of mesh or barrier along the stomach wall. When the carbohydrates from the rest of your meal arrive behind it, that fiber barrier dramatically slows down how quickly the sugar from those foods enters your bloodstream. Instead of a sharp, steep blood sugar spike, you get a much slower and gentler rise.
And blood sugar spikes are directly connected to blood pressure rising?
Directly connected. When blood sugar spikes sharply and suddenly, the body responds by releasing large surges of insulin. Insulin is the hormone the body uses to manage sugar in the blood. And when insulin floods the system in large quantities, one of its effects is to cause blood vessels to constrict, to squeeze tighter. Blood pressure rises silently after every high-sugar meal. Most people check their pressure in the morning, it looks reasonable, and they think everything is fine. But throughout the day, after every meal where carbohydrates come first, their blood pressure is spiking over and over again.
And that repeated squeezing day after day is adding up to real damage over time.
Over years, over decades. I had a patient, a retired school teacher, 71 years old, who came to me frustrated and confused. She was taking her medications faithfully, but her readings were inconsistent and frequently high in the afternoons. I asked her to do one single thing. Same food, same portions, same medications, same everything. Just eat the vegetables on her plate before touching anything else. 2 weeks later, she came back, and her afternoon readings had improved noticeably. She had changed absolutely nothing else, just the order.
Same food, same medication, just a different sequence. That is remarkable. Something so small producing that kind of result. So the second strategy, apple cider vinegar. A lot of people have this sitting in their kitchen already. What is it actually doing inside the body?
Apple cider vinegar contains an active compound called acetic acid, and this acetic acid works through two completely distinct mechanisms when it comes to blood pressure, which is what makes it so interesting. The first mechanism connects directly to what we just discussed about insulin. Acetic acid improves what scientists call insulin sensitivity. In simple terms, it helps the body respond to insulin more efficiently, so the body does not need to release as much of it after eating. Less insulin released means less constriction of the blood vessels after a meal. That post-meal blood pressure spike becomes smaller and less frequent.
And the second mechanism, you mentioned it was even more exciting from a scientific standpoint?
It genuinely is. Acetic acid stimulates the production of nitric oxide inside the walls of blood vessels. Nitric oxide is a natural signaling molecule. Think of it as a message the body sends to the arteries that says, relax, open up, let the blood flow through freely. It causes blood vessels to widen. There is an entire class of prescription blood pressure medications designed specifically to achieve this exact effect in the body. And here is this simple compound in a bottle of apple cider vinegar producing something remarkably similar at a cost of roughly $3 per bottle.
$3 doing what an entire class of prescription drugs is trying to do. How does someone actually use it correctly?
1 to 2 tablespoons diluted in at least 8 ounces of water, a full large glass taken with each meal, breakfast, lunch, and dinner. And I want to be very clear about the word diluted, because this matters.
What happens if someone just drinks it straight?
Undiluted, it is acidic enough to damage tooth enamel and irritate or injure the lining of the esophagus over time. Always dilute it fully and always use a straw when drinking it to protect your teeth. Anyone with a history of stomach ulcers or acid reflux should speak with their doctor before starting. For everyone else, give it 3 consistent weeks, take your blood pressure regularly, and watch what happens to your numbers.
Good practical guidance. Now I want to shift to something that I think will genuinely surprise most people listening: nocturnal hypertension, blood pressure problems that happen specifically during sleep. Can you explain what that actually is?
This is one of the most important and most overlooked issues in cardiovascular health for people over 60, and I am glad we are giving it proper attention. In a healthy cardiovascular system, blood pressure is supposed to drop during sleep. The body is at rest. The heart is supposed to get a break overnight. That natural nighttime dip is important and protective, but in many people over 60, that drop does not happen. The blood pressure either stays elevated or actually spikes during the night, while the person is lying in bed completely unaware, believing they are resting. The heart is working overtime all night long.
And this would not show up on a normal blood pressure check during the day?
That is exactly what makes it so dangerous. Standard daytime readings will not detect it. A person can have a perfectly acceptable reading at 9 in the morning and still have a serious, damaging overnight problem that nobody has identified. And nocturnal hypertension is strongly and consistently linked to elevated risk of stroke and heart attack, events that do not only happen during waking hours.
So what is the third strategy? How does someone address something that is happening while they are asleep?
About 30 grams of walnuts, that is roughly 14 walnut halves, a small amount that fits comfortably in the palm of your hand, eaten approximately 30 minutes before going to bed. Walnuts happen to be one of the richest plant-based sources of alpha-linolenic acid, which is a plant form of omega-3 fatty acid. Omega-3 works directly and powerfully on blood vessel walls. It reduces the chronic inflammation we have been talking about throughout this conversation, the very inflammation that causes stiffening and elevated pressure.
But walnuts do something additional beyond just the omega-3, correct?
They do. Walnuts also contain melatonin, the same compound your brain naturally produces to signal sleep, and an amino acid called L-arginine. These compounds work together to relax blood vessel walls during the night, reduce vascular inflammation specifically during the sleeping hours, and actively support that natural pressure drop the body is supposed to experience overnight. Think of it as sending a gentle cardiovascular signal right before bed. A biological instruction that says, it is time to rest, decompress, and let the pressure come down. A small handful of walnuts, 30 minutes before sleep. That is the third strategy.
I love how accessible that is. A handful of walnuts before bed, something anyone can do tonight. Now the fourth strategy, hibiscus tea, and you mentioned it works similarly to an entire category of prescription medication. That caught my attention immediately.
Hibiscus is a deep red flower that has been used in traditional medicine for centuries, across Africa, across Latin America, across the Middle East. In different cultures, it goes by different names: sorrel, carcade, red tea. It has a beautiful tart flavor, very similar to cranberry, and for centuries, people in those cultures used it intuitively, long before any laboratory understood why it worked.
And now the science has caught up to what those cultures already knew?
It has, and the findings are genuinely striking. Hibiscus contains two key families of active compounds: anthocyanins, which are the pigments that give it that deep red color, and hibiscus acids. Together, these compounds act in a way that closely mirrors a class of prescription drugs called ACE inhibitors. ACE inhibitors work by blocking a specific enzyme whose job in the body is to cause blood vessels to constrict. When you block that enzyme, the vessels relax, they widen, and blood pressure drops. Hibiscus does this naturally, through a cup of tea.
And there is a side effect issue with ACE inhibitors that hibiscus apparently avoids.
Yes, and this is practically very meaningful for patients. One of the most common complaints from people taking ACE inhibitor medications is a persistent, dry cough, a side effect that affects a significant number of patients and is often severe enough that they stop taking the medication altogether. Hibiscus achieves a similar mechanism through a different biochemical pathway and without causing that cough. Research found that daily hibiscus tea consumption reduced the top number in a blood pressure reading, the systolic pressure, by an average of 7 points in adults with mildly elevated pressure. In cardiovascular medicine, a 7-point reduction is described as clinically significant. It translates directly into reduced risk of stroke and heart attack.
7 points from tea. That is a real, meaningful number. How much should someone drink each day?
3 cups per day, hot or cold, whichever a person prefers, with minimal sugar or none at all. A small amount of honey is perfectly acceptable, but I must be very direct about one critical caution before anyone starts this. Anyone who is already taking ACE inhibitor medication must speak with their doctor before adding regular hibiscus tea to their routine. Combining the two could push blood pressure lower than is safe, dangerously low. Hibiscus is powerful, and that power needs to be respected. With proper medical guidance, it is an extraordinary tool. Without that guidance, for someone already on that specific class of drug, it could create a serious problem.
That is such an important warning. Thank you for being so clear about that. Now the fifth strategy, and this one I think will make people walk straight to their kitchen cupboard. Cooking oils. What are most people doing wrong?
I want to ask everyone listening to do exactly that. Go to the kitchen cupboard after this episode and look at the oils sitting there. Most people will find canola oil, soybean oil, sunflower oil, or corn oil. These have been marketed as heart-healthy choices for decades, and I want to explain carefully and clearly why they are actively contributing to blood vessel damage.
What is the core problem with these oils?
These oils are extremely high in omega-6 fatty acids. Now, omega-6 is not inherently harmful. The body does need some of it, but the ratio between omega-6 and omega-3 in the diet matters enormously. For most of human history, people consumed roughly equal amounts of both. That balance is fundamental to how the body regulates inflammation. Today, because of these cooking oils and the processed foods made from them, the average person is consuming 15 to 20 times more omega-6 than omega-3. 15 to 20 times. That extreme imbalance is one of the primary drivers of the chronic systemic inflammation that is silently damaging blood vessel walls. The exact problem at the heart of everything we have discussed today.
And there is a second issue with these oils beyond just the omega-6 imbalance?
Yes, and this second issue is just as damaging. These oils are heat unstable. When you heat canola or soybean oil to normal cooking temperatures, the heat required to actually fry or sauté food properly, the oil breaks down chemically. It oxidizes. And when it oxidizes, it produces compounds called aldehydes. Aldehydes are directly toxic to the walls of blood vessels. You are not simply eating oil. You are eating oil that has been chemically transformed at high heat into something that actively attacks the arterial tissue we are trying to protect.
So what do we replace them with, and how difficult is that switch?
It is a very simple switch. For low to medium heat cooking, sautéing, gentle frying, roasting at moderate temperatures, use extra virgin olive oil. Olive oil contains a natural anti-inflammatory compound called oleocanthal, which works in the body through a mechanism similar to common anti-inflammatory medicines without their side effects. It is also rich in monounsaturated fats that actively support heart health. For high heat cooking, the kind of heat where olive oil begins to break down, use real butter, preferably from grass-fed cows. Real butter is far superior to margarine. Margarine is made from the same problematic seed oils, simply processed into a solid form. Do not be misled by the resemblance.
And does someone need to throw out everything in their cupboard immediately?
Absolutely not. And I always tell patients this. Do not throw anything away. Simply stop purchasing these oils when the current bottles run out. Replace them with olive oil gradually as you go. This single change, made consistently over 3 to 6 months, can produce measurable reductions in inflammatory markers in the blood and meaningful improvements in blood pressure. No dramatic overhaul required, just a quiet, steady replacement.
That is so achievable. No dramatic overhaul. Just stop buying the old ones and bring in the new ones over time. Doctor, I want to come back to where we started. That man. The 67-year-old on the operating table with arteries like concrete pipes. What happened to him after surgery when he adopted these changes?
Under careful and continuous medical supervision, he adopted all 5 of these changes in the months following surgery. He did not abandon his medications. That is very important to understand. He worked closely with his cardiologist throughout the entire process. The food strategies and the medical treatment worked together, not in opposition. 6 months later, his doctor reduced him from 4 blood pressure medications to 2. His inflammatory markers, the blood tests that measure chronic inflammation in the body, dropped significantly. His blood pressure became consistently stable in a way it had not been in years. For the first time in a very long time, his readings were reliably where they needed to be.
From 4 medications to 2 in 6 months. And what did he say when he saw those results?
He looked at me and said, "Why did nobody tell me this sooner?" That question is the reason I keep doing this work. The research behind these strategies exists. The science is not hidden or secret, but somewhere between the laboratory, the doctor's office, and the patient's kitchen table, this information gets lost. Appointments are short, medication is fast and measurable, and so people leave with another prescription, but without the knowledge of what they could be doing every single day in their own home. That has to change.
Why did nobody tell me this sooner? I think that question is going to sit with a lot of people watching this today. Doctor, last question. If you could leave every listener over 60 with one single most important message, what would it be?
Do not wait for a crisis to take this seriously. That man was not careless or irresponsible. He was doing everything his doctor told him, but nobody had told him about the daily decisions that were quietly feeding the inflammation inside his vessels year after year. By the time the crisis arrived, the damage was already severe. The 5 strategies are all simple and all accessible. Eat vegetables first at every single meal. Take diluted apple cider vinegar with each meal. Eat a small handful of walnuts 30 minutes before bed. Drink 3 cups of hibiscus tea each day with little or no sugar. And replace your seed oils with extra virgin olive oil and real butter. That is the complete list. None of it is complicated. None of it requires a prescription.
And where should someone start, all 5 at once?
One thing, just one. Pick the strategy that feels most natural or most manageable to you right now. Do it consistently for 2 weeks. Let it settle into a habit. Then add the next one. Sustainable change is not built from a dramatic overhaul. It is built from one small, repeated decision made faithfully day after day until it simply becomes the way you live. And I want to close with something I feel very strongly about. Everything we have discussed today is general information based on research and clinical experience. It is not a replacement for personal medical care. If you are currently taking blood pressure medication, do not stop it, do not reduce it, without speaking to your doctor first. These strategies work best alongside proper medical supervision, not instead of it. The goal is to give your body the best possible daily conditions so that everything else works better, your vessels stay healthier, and over time, in conversation with your doctor, perhaps the medical burden becomes lighter. The blood vessels are remarkably responsive at any age. It is genuinely never too late to begin.
It is never too late to begin. What a perfect note to end on. Before we close, I want to ask everyone listening one question. Which of these 5 strategies are you going to start tonight? Leave your answer in the comments below. We read every single one, and your answer might be exactly the push that another listener over 60 needs to take that first step. If this episode helped you, please like this video, subscribe to Older Podcast, and share it with someone over 60 who needs to hear this.